Welcome back. I hope you've had an amazing week. This is GP Made Easy and I'm Dr. Daniel Follows, a fully qualified GP living and working in the UK. Today we're going to be covering contraception. So there are many different methods available and they each come with their own advantages and disadvantages. And also some of the hormonal methods are also used interchangeably to treat certain conditions such as painful periods and heavy periods. I'm hoping by the end of this video you'll have a better understanding of each method and be able to explain them to patients much better. Before we go into the video, don't forget to like, comment and subscribe so I know that you're enjoying this content. So let's get on with the video. First of all, just a little bit of background information. So previously it used to be a patient would come in, we'd give them a lot of information and then let them decide. But nowadays the better model is to identify what she wants out of the contraception. For example, does she want one with a low failure rate? Does she want one that has quick reversibility? She suddenly decides she wants to start a family. Does she want one that causes more regular, lighter or no periods? Does she want one that's more convenient? Or does she want one that contains no hormones at all? For every woman as well, it's also recommended to offer them an STI check, including HIV, and to also give them resources of their local sexual health services if they need them in future. And for patients, you need to remind them that condoms are the only way to prevent against STIs. Onto some facts about contraception. So without any contraception, about 85% of women having unprotected intercourse will become pregnant within 1 year. And after birth, fertility returns within about 3 weeks, unless breastfeeding, which we'll cover later on in the video. And if anyone has a miscarriage or termination, fertility returns immediately. Moving on to how the methods work, they each have their different way of working, and up here I've got a diagram that shows each area where they work. There's about 4 main areas. So first of all, there's the prevention of sperm entering, and methods for this include male sterilisation, condoms, the progesterone only pill, the levonorgestrel containing coils and diaphragms. Next we move on to methods that prevent a fertilised egg from implanting in the uterus, and these include the levonorgestrel containing coil, the copper coil and the emergency copper coil. Next, there are methods that prevent a sperm and an egg from meeting in the first place, and these include female sterilisation, fertility awareness, the levonorgestrel containing coil, the copper coil and condoms. And finally, there are methods that prevent ovulation in the first place, and these include the implant, the combined hormonal contraception and the progesterone only pill. Moving on, so up here I've got a table and you can see it's got ranked in order from most to least effective each different contraception method, and from the top you can see that implant is the most effective, with fertility awareness methods being at the bottom. Comment down below if any of the order of these have shocked you, because it did open my eyes a bit as well. Next, I've also got another table up here, and as you can see, for certain methods such as the pills, there is a difference in failure rate between perfect use and typical use. So that's something to take note as well when you're deciding which method you would prefer. So next I'm going to be discussing each method in more detail, and as part of the discussion, each one I'm going to put up their failure rate, which is the likelihood of you getting pregnant within 1 year of using that method. So first of all, we're going to start off with the implant. So its brand name is called Nexplanon. As you can see from the diagram up here, it's a small little rod that's inserted just under the skin of your upper arm. and it releases progesterone into the body. It's safe for most women to use and lasts for 3 years. Commonest side effect of it is it can cause some irregular bleeding, and it has a 0.05% failure rate. Next, we're going to move on to the levonorgestrel containing intrauterine device. So you can see from the diagram up here, it's just a small little device that's inserted as a day case procedure and just sits in the uterus, and it releases progesterone locally into the uterus. Now, there are a few brands available. I'll put them all up here, but the commonest ones whereof are the Mirena, the Kyleena and Jade-S. Now, the majority of them last for over 5 years. Only the Jade-S lasts for about 3 years because it has less of the hormone in it. And one thing to note, if they are inserted in any women over 45, it is recommended that they can stay until they're over 55, so they've been through the menopause and don't need further contraception after that. It's suitable for most women. The commonest side effect is it can cause some irregular bleeding, but this only lasts for the first few months. For most people, it settles down after 3 to 6 months. And for most women, systemic side effects are rare as the progesterone just acts locally. It can also be used as the progesterone component of your hormone replacement therapy, and it has a 0.2% failure rate. Now on to the copper intrauterine device. So it's quite similar to the progesterone IUDs, but this time it doesn't have any hormone, it's just a copper device inserted to the same area as the progesterone one, so it just sits in the uterus. It's suitable for most women, and once inserted can last in there for 10 years. Commonest side effect is it can make your periods heavier, and it has a 0.8% failure rate. Next, we move on to the contraceptive injection. So the commonest one known to us is the Depo-Provera, and it's given as an IM injection into the arm or buttock, and it's the progesterone hormone that's injected. There is also another one called Cyana Press that is given as a subcutaneous injection, but please check with your local practice/area if it's available, as I have not seen it used that much. It's suitable for most women, and each injection lasts for about 13 weeks. Just to make you aware that when you stop the Depo injection, it can take up to 1 year for your fertility to return. Side effects include weight gain, irregular or heavy periods, but this tends to occur just for the first few months. Then women tend to get infrequent or no periods, and they can also cause decreased bone density, so it can make your bones a bit more brittle, but it's shown that when you stop the injection, your bones become normal again, and the injection has about a 6% failure rate. Moving on to the combined hormonal contraceptives, so we'll start off with the pill. So they contain both the estrogen and progesterone hormone, and the typical regime is that you have it for 21 days in a row and then have a 7-day break. But there are tailored regimes if someone needs to try a different method. Up here, I've got the table showing all the different tailored regimes that are available. So for example, there is one where you can give 3 months worth back to back. Now, there are some contraindications to the combined hormonal contraception, such as if they're over 35 and a heavy smoker, if they have migraine with aura, which is where you get migraine headaches with the visual floaters, or if you currently have or have had in the past a history of breast cancer. Commonest side effects include nausea, headache, and irregular bleeding, but the side effects can be decreased by changing the brand. So up here, I've got a table with some of the commonest brands available in the UK, and as you can see, the different brands have a different amount of the estrogen type hormone in there, or a completely different progesterone hormone in there. One thing to warn patients about is if they have any episodes of diarrhea or vomiting, that can affect the effectiveness of the pill, so they'll need to use extra methods such as barrier methods during that time. But one thing that combined hormonal contraceptives have been shown to do is to decrease the chance of getting uterine, ovarian or bowel cancer. However, with the combined hormonal contraceptives, there is a small increased risk of blood clots, and the rate is about 3 to 10 people per 10,000 people on the combined hormonal contraceptives. There is a very small increased risk of breast cancer, and there is also a small increased risk of cervical cancer if they're used for over 5 years, and they have a 9% failure rate. So next we're going to cover the combined hormonal patches and rings. I've got some pictures of them up here. They have the same side effects and contraindications as the pill. And again, you can use the classic regime or the tailored regimes as well. So the patch tends to be changed every week, whereas the ring just sits up around the cervix and is changed every 3 weeks. Now the benefit of these methods over the pill is that they're not affected by diarrhea and vomiting, so you don't need to use any extra methods during that time. And they also have a 9% failure rate, just like the pill. Next we're moving on to the progesterone only pill. So as the name suggests, it's just the progesterone hormone taken as a pill. You take it once a day and there is no break. Benefit of this is there's a 12-hour missed pill window, so if you've missed it but take it within that 12-hour window, you don't need to use any extra methods. And the side effects are they may stop your periods or your periods may become irregular, and it has a 9% failure rate. Next is the cervical caps / diaphragms. So these are inserted just before intercourse and you leave them in for about 6 hours post intercourse. But to have maximum effectiveness, it's shown to use a spermicide with them as well. Side effect is vaginal irritation, and it has about a 12% failure rate. And now on to the fertility awareness methods, where this is just avoiding having intercourse during the days of ovulation. Now for a typical cycle, this tends to be days 9 to 16, but this can vary person to person, so you have to do quite a bit of research to make it individualized for each person. With this method though, there is a high chance of failure as it has a 24% failure rate. Moving on to condoms, so there are both male and female condoms, and these are the only methods that prevent against sexually transmitted infections, and you have to use them every time you have intercourse. Commonest side effect is it could sometimes cause irritation if someone has a latex allergy, but these days there are non-latex versions available. Now the male condoms have about 18% failure rate and the female condoms have a 21% failure rate. Next is female sterilization. So this is where both fallopian tubes are clipped. This is a permanent method, but patients can get this reversed if they want, but to make you aware it has a high failure rate and this is not done on the NHS, it's done privately. Side effect is, in some people it may cause a heavier period and it has a 0.5% failure rate. Moving on to male sterilisation, or as it's more commonly known as vasectomy. See from the diagram up here, the procedure involves cutting both vas deferens, which is essentially the tube that goes from the testes, takes the sperm to the penis. And this procedure is done as a day case procedure. Just to make you aware, for the procedure to be classed as successful, the man has a semen analysis at 12 weeks to make sure he's not producing any sperm. So for those 12 weeks, they still have to use some other method until the vasectomy has been confirmed to have worked. Side effect of the procedure is some men can be left with a chronic scrotal pain syndrome. Again, this is a permanent procedure, but you can get it reversed. But again, this also has a high chance of failure, and again, it's done privately, not on the NHS. and a vasectomy has about a 0.15% failure rate. So that's all the contraceptive methods currently available. And now just some little extra facts. So for the hormonal methods, for the majority of them, they take about 7 days to build up in your system. So you need to use extra methods during that time, apart from the progesterone only pill, which only takes 2 days to build up. Another thing to be aware of is after someone is given birth, they can have a method called lactational amenorrhea for birth control. But to qualify for this, they need to meet the following 3 criteria: that they are less than 6 months postnatal, they are not having any periods at all, and they are fully breastfeeding. So again, they need to meet these 3 criteria to be eligible for lactational amenorrhea for birth control. Another tip, there is also a website called the UK MEC, which I'll just show it briefly up here, which has all certain criteria, contraindications for certain contraceptive methods. And another thing I found out recently is that they've also created a calculator, which I'll put a screenshot up here, where it's essentially you input the woman's data, tick any tick boxes, and for each of the different methods it will give you a category if they're suitable for it, with 1 being the fine, 2 the benefits outweigh the risks, 3 the risks outweigh the benefits, and 4 is no, they shouldn't be having that at all. Next is emergency contraception. So these are what's given if someone's had unprotected sex or they feel their current contraceptive method didn't work. There are 3 available on the NHS. There's the copper coil, which can be given up to 5 days after intercourse. There's ulipristal acetate, which is a pill that can be given up to 120 hours after intercourse. And there's the levonorgestrel pill, which can be given up to 72 hours after intercourse. Now, to make you aware that if the intercourse happened after the woman's ovulation date, then the pills are less likely to be effective. Currently in the UK, anyone over 16 can consent to contraception on their own, but anyone aged between 13 and 16, there is something called the Fraser Guideline, which is legal frameworks to assess if someone between these ages can consent to contraception on their own. And for this, they must meet the following criteria: that they have the maturity and intelligence to be able to understand the nature and the implications of the treatment, that they cannot be convinced to tell their parents or allow the doctor to tell their parents, if they're very likely to begin or continue to have intercourse with or without contraception, or if they're likely to receive physical or mental damage unless they receive advice or treatment. And to make you aware that anyone under the age of 13 is unable to consent for intercourse, and if they are having any, you need to report it to social services and the police. Well, that's it for today's video. I hope you found it helpful. In the description below, I'll link all the resources I've mentioned today, and also an RCGP learning module to help you get some CPD points. Don't forget to like, comment and subscribe so I know that you're enjoying this content. And if there's anything you'd like me to cover in a future video, then comment down below. I'm also on Instagram, which is up here. It's the same name, it's GP Made Easy. Or if you would like to, you can contact me via email, and it's up here. Well, I hope you guys have an amazing week, and I will see you in the next video.